My name is Cindy Johns, and I am a certified laboratory professional. I am also a 5-time cancer survivor. I was originally diagnosed in 1999 when I felt a lump in my breast. You know, anytime there's a lump, then they always want to check it out with a biopsy.
My name is James Wilson, and I was diagnosed with Ewing sarcoma cancer in the tissue.
James contracted cancer at the age of 13. He had treatment for about 1 year. So on July 7th of 2015, James was officially declared cancer-free.
I went through the treatments and was cancer-free for 13 years until 2012 when it came back again. And then in 2014, it came back for a third time. The tumors had come back in the lymph nodes. So I said, well, I'm handling this. How many, what do we have to do to get this to stop?
Reason why I took our son James to the doctor was he had very excruciating pain in his stomach.
He was at Ivinson Memorial Hospital in Laramie, Wyoming, under the knife with a surgeon going in with a scope, only later to find that he had a tumor or a mass outside of his bladder.
He immediately suggested us to take James to Children's Hospital. And when we went, they took a sample.
I had to have surgery to remove some lymph nodes. I specifically asked my physician if he would draw the tumor marker. And then in 2015, it came back for a 5th time. That was probably the one moment in this entire journey that I wasn't sure what to do or how to feel. It's the one time throughout this whole process that I actually broke down in tears.
When we found out that James had cancer, it was just shocking. We basically didn't have a way to express our feeling.
Your life is fully intact and you feel like you have this sense of purpose, and then that purpose sort of loses its way when you get cancer. And then you sort of have to rethink everything.
One of the things that I've always told people who are in that same situation, if they've been diagnosed, they don't know anything about the laboratory, always get a copy of your lab results.
What I would tell other children that are going through this cancer battle is that they have to always stay positive, that they always have to think long-term instead of short-term, that there's always that chance that you're always going to get through it no matter what.
What I would like people to remember is, first of all, that I was a good person, that I tried to always do the right thing, that I treated people well, and that I always dedicated myself to whatever task was at hand, whether that was working in the laboratory, doing the best you could, or volunteering in order to make someone else's life better.
My legacy, what I want to be known for, is probably how I used not only my talent but also my experience to help others. One of the things that I've been really focusing on, especially after my cancer battle, is going to different charities and also events, trying to get other people excited about finding a cure, and being able to make these right decisions is what leads to us cancer patients living. So I would feel like without pathologists, I wouldn't even be here today.
Without the laboratory, I probably would not be sitting here.